Cancer is an abnormal growth of cells, and if the immune system or some other parts of the body system loses control, these cells overgrow, they mutate, means they can build inside mutations for their benefit, that they can grow fast, that they can invade in organs, and that they can leave their traces. This is how cancer is coming up, because its cells are growing faster. They have more blood vessels to invade in other cells, change other cells into cancer cells. And the aggressors or triggers are a lot of. Could be toxins, could be viruses, could be stress related. It could be radiation, for example. So there are a lot of stressors what makes at one point a cell growing abnormally fast. A cancer cell not only has 10 genes or 5 surface markers. We can detect it over what is called liquid biopsies. So when we do liquid biopsies, we can detect from the blood the abnormal pathways of the cancer cells, and we know exactly what chemo drug we need to use, what antibody we need to use. We can do the same with alternative therapies like vitamin C, antioxidants, herbal therapies like curcumin, or from the functional medicine side, how we can influence a cancer cell in stopping the growth. When we look at the surface marker of cells, and if we find abnormal surface markers, and there are 30 different abnormal surface markers, what we can detect, what goes in the direction of pancreatic cancer, colorectal cancer, hematological disorders like leukemia, lymphoma, breast cancer, prostate cancer. So every cancer has its different markers what the normal cells don't have. And we can detect how aggressive these cells behave. So we can detect genes on the surface or in the inside of cancer cells, what can make cancer cells changed in a way that there is an abnormal growth. In the last few years, the treatment options for cancer improved, definitely through diagnostics, because we can detect nowadays pathways in the cancer cells, what the normal cells don't have. We can detect surface markers on the cancer cells, and we can, dependent on these findings, make what are called biological therapies like antibodies to block targeted for the cancer patient. I think this is a very important point, what we can do nowadays, screening the blood for abnormal signals and building with these cells what we can isolate as cancer cells, where we can put in different chemotherapies, secondary herbal extracts to see what is working best. But before it comes to the point, we have nowadays the option to detect cancer in advance. Before we have a cancer cell, we can detect a cancer cell and then treat the immune system accordingly when there are weaknesses, get rid of the viruses, get rid of the toxins, and then we can control again if these abnormal cells stay in our blood or not. So we have a very good before and after control for that.